Breakfast of champions. Yeah. Ooh, spicy.
Most of them white, a lot of them.
Ever get the chance to eat my mom's sweets on some right spicy noodles
Yeah.
in the morning for breakfast?
You're not spending it, so you're not getting, so you're getting the services you think you need. No, it's eventually. You're gonna start calling me, asking why grandma played on the phone.
All right. We're live. So
Okay, folks, it's 8:35. Let's get started.
Yeah.
Don't forget to turn off your gadgets or phones, anything that might make noise. Just observing your enhanced vision capabilities as you were surveying the room. Your eyes still clear? Yeah, it's amazing, isn't it? Yeah. I just told somebody about cataracts.
He doesn't see the golf ball very well.
Well,
As long as you got 2 or 3 guys that are watching, he hits it good, you just can't see what.
if it's a white piece of cotton, that's close enough, so. Okay, let's start with a roll call, please.
Bell.
Here.
Curran.
Here.
Freeling. Harrison.
Here.
Hinkleman.
Here.
Majerick.
Here.
Ott. Pittsford.
Here.
Walrath.
Here.
Warfel. Here. Yarborough. Elliott. Mr. Chair, we have 3 absent. Oh, sorry. I didn't see you come in. We have 2 absent.
Here, Terry will not be here at least for the first meeting, maybe the second, I'm not sure. But I don't know about Alex at this point. Anyway, minutes need to be approved. It says here July 18. Is that correct?
Yeah, there was no committee of the whole before the night meeting. And no
Oh,
committee of the
that's
whole.
right. That's right. We didn't meet the week prior. Okay,
I make a
So-
motion, we approve the committee of the whole meeting minutes.
okay. Mr. Ott is here. Moved by Pitchford. Is there support? Supported by Bullrath. Any discussion? Hearing none, all in favor signify by saying aye. Opposed, same side or same sign. Minutes are approved. Requisition review. Somebody needs to go out of town for a few days. Requisitions.
Good morning. Does anybody have any questions about the requisition list? Thank you.
Thank you. All right. Is Guy doing that?
Yeah, so for this morning, we have a presentation. We have Peter Sando, he is here from Riverwood. Over the last couple of months, Commissioner Majerick had mentioned that Riverwood has been providing guidance, training, and just explanation on the use of Narcan. He had suggested that I connect with Riverwood. I've since done that. Peter is here on behalf of Riverwood. The purpose of today's discussion is to help you all understand what Narcan is, how it potentially can be used, and essentially help you understand that this is a product that the county is actively making available to county residents. So we have both the sheriff as well as the court administrator here today to talk, well, should you have questions for them. Narcan is being made available in the jail. We also have a vending machine set up at South County Courthouse. Peter is going to walk you through his presentation, and then should the board have any questions, feel free to ask him. Very much appreciate him coming today to talk to you. Peter, are you ready?
Yes, I am.
Okay.
Morning, Peter.
Good morning. Okay, in today's presentation, we'll be discussing the following: what Narcan is, Riverwood's participation in Narcan distribution, the definition of an overdose, substances on the rise, such as xylazine, fentanyl, stimulants, recognizing symptoms of an overdose, increased risk factors for an overdose, how to respond, prevent an overdose, and how to use a Narcan kit and where to find them. So my name is Peter Sando. I've been a recovery coach for almost 6 years, and I've worked at Riverwood Center since January 2022. I've been in recovery myself for 7 years and have witnessed firsthand the impact of addiction from dealing with my own lifelong struggles with addiction, as well as friends and family dealing with their own struggles of addiction. Raising awareness and harm reduction and the use of Narcan is a passion of mine. I have lost family and friends to overdoses that may or may not have been prevented if Narcan had been available at the time. I have since received training on the use of Narcan and how to reverse or prevent an opioid overdose. Narcan is a brand name for naloxone, a medication used to reverse opioid overdoses. Narcan works by binding to opioid receptors in the brain, displacing the opioids and blocking their effects, restoring the person's respiratory system that had shut down due to an overdose. Majority of the Narcan that we will use today is a simple, easy to spray in the nose nasal spray. So in the picture here, you see that if you go to Riverwood in front of the Benton Harbor office and Niles office, you'll see one of these boxes, these old mailboxes where you can get Narcan 24/7, any time of the day or night. Since Riverwood has been participating in distributing Narcan, we have distributed 677 kits since February of 2023. I have personally trained 391 people, and that's going out in the community. I go out to the motels, homeless camps, different areas in the communities where I know people use and overdoses have occurred. And I've had reports back that 42 of these kits have been used in successful overdose reversals since February of 23. So that's a huge win for us. What is an overdose? An overdose happens when someone takes too much of a drug or medicine, causing harmful and life-threatening effects. For example, with opioids, an overdose can make a person stop breathing, become unconscious, and potentially die if not treated quickly. An opioid overdose will cause a person's respiratory system to shut down, causing the person not to be able to breathe. And one thing I want to touch on this is I get a resistance a lot when people think that it's not going to happen in their backyard. It's not going to happen in their community. If I take a Narcan kit, then I'm associating myself with the use of hard drugs. So part of me doing these presentations is trying to break that stigma and knowing that Narcan kit should be in every home in the nation, I think, really. But we start off in our communities, right? Getting them in every home, every car. I personally have a kit in my vehicle, my wife's vehicle, in my home, in my office. You know, I don't anticipate anybody ever coming over my house that's using, but you just never know. You know, I've seen people that you would never think use substances who do use. So it's just being aware of that. And then we'll get into it later, bring a kit for everyone here today if they would like to get one. I think that's a good start for our community to see the commissioners taking a kit. All right. Substances attributed to a recent increase of overdose. Xylazine. This is a big one. Xylazine is a non-opioid sedative or tranquilizer. Although not a controlled substance in the US, it is not approved for use in people. In recent years, xylazine has been mixed with other drugs, but most common drug is being mixed with fentanyl, creating what is called on the street tranq. I've had clients of mine tell me that they actually have stopped using and seeked help because they could tell the difference in the drugs they were getting. With it being mixed with a tranquilizer, it said to have people in a zombie state, leaving them unable to move for hours at a time. And that's exactly what my consumers have expressed to me and why they've sought help now. And then fentanyl, a synthetic opioid medication originally created for medical use, but has more recently become prevalent in the illicit drug supply and is the leading cause of overdose deaths in the US. Fentanyl is roughly 50 to 100 times more potent than morphine and heroin. I think in the past 2 years, I've seen 2 people test positive for heroin. The rest is all fentanyl now. And what's really killing the people is the mixture of mixing these drugs, whether it's mixing it with the stimulants or the xylazine, benzodiazepines, alcohol, but we'll get to that in a minute. Stimulants such as methamphetamine and cocaine, we're seeing crack cocaine on the rise again, and meth as well. It's coming back. These are types of substances that increase activity or alertness in the brain or body, resulting in increased heart rate, heightened blood pressure, temperature, anxiety, agitation. Okay, what does an overdose look like? Overdoses can look different depending on the type of substance used or ingested. Knowing what signs and symptoms to look for in an opioid overdose versus stimulant overdose can help in identifying the appropriate response or course of action. An opioid overdose, loss of consciousness, unresponsive, respiratory distress or failure. This is where we talked about for an opioid overdose, it shuts down our respiratory system completely, stopping a person from breathing. So one of the ways we can tell that that's about to happen is what we call the death rattle. We hear a deep, shallow breathing with almost a gurgling sound in their chest. And that's a significant sign that someone is close to an overdose or has overdosed. We look for pale blue skin, lips, fingernails that indicates the loss of oxygen in the body. Foaming at the mouth, throw up a foam in the mouth, pinpoint or constricted pupils. And then for the stimulant overdose, we see a lot of agitation, restlessness. It could cause seizures, respiratory distress as well, profuse sweating, stroke or heart attack is the big one for this, and dilated pupils compared to pinpoint or constricted pupils. Narcan is only affected in an opioid overdose, but still it's important, even if the person is a known stimulant user, we're seeing more overdoses with the known stimulant users because it's being cut with fentanyl. I've known people to take a hit of crack and overdose instantly on fentanyl. It's because they didn't have no tolerance. Same with injecting methamphetamines. They died because there was fentanyl in it and they didn't know. They were used to doing meth and that's all they thought was in there and they had no tolerance to the opioid. As well as pressed pills. See a lot of the pressed pills. A lot of people go from getting them from the doctor or pharmacy, they build a tolerance and they need more, or they get cut off of their opioids, then they seek them on the streets. And you can buy a pill press machine on Amazon for $20 and you can form a pill that looks just like any other pill they're seeking. Okay, so still give the Narcan no matter what. Okay. What can increase the risk of an opioid overdose? Taking more than the recommended dose. So in this case, the recommended dose is by your prescribing doctor. Mixing opioids with other drugs such as benzodiazepines, xylazine, stimulants. No tolerance to opioids. That's what I was just talking about. We are seeing more deaths in stimulant users due to no tolerance and the person's drug of choice being mixed with fentanyl without the person knowing. Loss of tolerance and returning to a high dose. Relapse after long abstinence from opioids. Being a stimulant user and your drug of choice gets cut with opioids such as fentanyl. Also, we see people getting out of jail, right? That's a huge one for people getting out of jail and returning back to their normal use. They think they have to use the same amount they used when they went into jail or rehab, right? Or they were successful in their recovery for a short period of time or long-term and relapse, like it said. The quality of the drug, the potency. Using alone is another big one. We need to educate those around us about using alone. If I have a Narcan kit and I'm using alone, I can't save my own life. So there's an app called the Brave app, which you can download on your phone and you can log in and you put emergency contacts in there. And if you log in when you're about to use, and if you become unresponsive or don't log back in or respond back to their message within a certain amount of time, they'll send paramedics to your location. There's also the Never Use Alone hotline. With that, the same, similar, very similar. You can call this hotline when you're about to use, and if you become unresponsive within a certain amount of time, they will send paramedics to your location. The only problem with this is I know when I used drugs, I didn't want people to know. You know, I was ashamed and embarrassed and felt if I did tell anybody that I could potentially be arrested, right? And so I think that is a barrier in these apps and Never Use Alone hotline. But I believe there's new laws now to protect people from getting arrested on overdoses. And then obtaining prescription drugs from unreliable sources. This is where I was talking about getting pills on the streets that end up being pressed fentanyl. I've seen and heard of people thinking they were getting Percocets that it was really just pressed fentanyl, thinking they were getting a Molly that had fentanyl in it and overdosing. And changing the route of the administration, for example, switching from smoking or snorting to injecting, putting it straight into your bloodstreams. And then medical conditions affecting respiratory, COPD, asthma, emphysema. This drug is attacking our respiratory system. So if we already have these respiratory diseases, then the likelihood of us overdose is more significant. All right, how to prevent an overdose. Educate those around you. Let people know. Give people Narcan. Be aware of situations where tolerance is decreased. If you have a family member that just got out of rehab or loved one or jail or they quit, you know, you notice they relapse. Those are areas where we need to pay attention to. Being aware of drug or medication interactions. Getting xyloxine and fentanyl test strips. They can be ordered online. This is something I would really like to get in our community. I really think this could save a lot of people's lives as well. So that's just another task of mine to help get in this community. Never Using Alone. I just talked about the Brave app and the Never Use Alone hotline. All right. Responding to a potential overdose. If we believe someone has overdosed, we're going to want to do what's called a sternum rub. And we're going to take our knuckle and we're going to rub it really hard as we can on their sternum. And if they acknowledge that, they're probably not an overdose. They may just be nodded out. And that may be mistaken a lot because a lot of times people just nod out and it may look like they're unconscious. They may have passed out from the drug, but if they acknowledge that in any way, they're not in an overdose. If they don't acknowledge that, the first thing we're going to want to do is call 911. And then right there's the Good Samaritan law. It's been in effect since January 2017. If I call the ambulance for somebody who has overdosed, that protects me. So next I want to do once I call the ambulance, call 911, is check their oxygen airway. I don't want to give them Narcan and then they choke on the throw up in their mouth, right? So in these kits comes a rubber glove, 2 rubber gloves. If they do have foam in their mouth, we're gonna wanna roll them on their side, take the gloves, put 2 fingers in their mouth and scoop from side to side, pulling out any foam or any fluids in their mouth. The next is we'll get into the rescue breathing. We're gonna place one hand on their forehead. Oops. One hand on their forehead and the other hand behind the neck, straightening out their neck and their oxygen airway. We want that to be straight as possible. We're gonna plug their nose and put this face filter on us that comes in each Narcan kit as well. And we're gonna give 2 quick breaths. If we see their chest rise up, that means we have a good seal. If we do not see their chest rise up, that means we don't have a good seal and we may need to make some adjustments. So in doing that, after we we know we have a good seal, we're gonna, every 5 seconds, give a breath. 1, 2, 3, 4, 5, breath. In this situation, I really need to do my best to remain calm and just give them their breaths and make sure that I'm breathing too. I can't give them all of my oxygen. And then we're gonna do that for 2 to 3 minutes and then evaluate the person. Is the person responding on their own to the rescue breathing? So given the rescue breathing, it can remind our lungs to start breathing again. So we may not even have to give the Narcan. And then, so if they're still not breathing, then we're gonna perform the Narcan. That is the simple nasal sprays. You just stick one up in the person's nose and put your finger on the red plunger and push it up there, and it will spray into their nose and go through their sinuses into their brain. You gotta be very careful with these. In trainings, I've had them open and I just barely touched that red plunger and it sprayed it up into the air. So I always tell people, just don't put your finger on it until you're about to use it, until it's actually in their nose and ready to use. And so we'll do that for every 2 to 3 minutes. We're gonna evaluate and repeat the cycle of rescue breathing and giving the Narcan every 2 to 3 minutes. And then we're gonna evaluate and support again. If the person did wake up, we're gonna wanna be supportive as possible to them. We just put them in a precipitated withdrawal. So they're not gonna be feeling comfortable. We took them out of their high. Their first thoughts are gonna be, I wanna go use. They may be angry. The naloxone wears off in 30 to 90 minutes, depending on the potency of the drug and our tolerance. So another thing, just be their friend, be supportive. If they get up and leave, we can't stop them forcefully, unfortunately. But we can be surprised what words can do. And all someone needs is one chance. They may have went to rehab 10 times. They may have overdosed before. But this one Narcan could be the hope they need to do what they need to do to get in recovery. It could be an eye opener for them. So we never should eliminate anybody from the potential of getting into recovery. If that's the case, I wouldn't be here today. This all stands for the acronym SCARE ME. The S is stimulate, the C call 911, the A airway, R rescue breathing, E evaluate, M mucosal atomization, then E evaluate and support. These are all locations where we can find Narcan kits: the Berrien County Jail Lobby, the Berrien County Health Department, Benton Harbor Niles, Riverwood Center, Benton Harbor Niles location, Carroll's Hope Engagement Center, Cornwall Health Center for Wellness, Cornwall Health Southwestern Medical Pediatric, Cornwall Health Southwestern Medical Primary Care, and Cornwall Health Southwestern Medical Walk-In, along with most pharmacies. Then there's some links down below as well that you guys can click on. The first one, the BerrienCounty.org 1975 free Narcan locations, gives all the addresses to where Narcan locations are at. Okay, and then the next 3 are links where you can click on or go to look at Narcan online and order them online. All right, so another place to get them is the drive-through that the health department is holding on August 31st. August 28th and 29th. The one on Wednesday, the 28th, will be at the Benton Harbor location, and on August 29th will be at the Niles location. These will be from 9 to 12 and 1 to 4 at both locations. Another place is Riverwood is holding our annual recovery awareness picnic, September 14th. We will be handing out Narcan kits there as well. This is open, free to the community. We're having a lot of testimonials given there. So I encourage anybody, anybody or want to come yourself to come. There's gonna be a lot of giveaways, a lot of games. It's gonna be a good time. It always is. And that is at the Benton Township Park, September 14th from 12 to 4. Then I have my information up here, my contact information. If anybody would like it, it's there for you guys. And that is it. Does anybody have any questions?
Yes, sir.
Less of a question, more of a statement. I really appreciate the work that's being done here. I lost my best friend to an overdose back in 2017. And it's been hard. It was hard to even hear this presentation, but just knowing that these kits are available and that you're going to save a life is really important. I just want to say hats off to you, man.
Thank you so much.
You don't look like what you've been through. You are amazing. Thank you. So thank you so much.
I know this, oh, sorry, go ahead.
Yes, ma'am.
I was just saying, I know the struggle. I lost a cousin of mine 13 years ago, and then I've lost several friends along the way. I also was a meth and heroin user, IV user. So it's only by the grace of God that I'm here today. And I believe this is part of my purpose of being here, is to fight this battle and help other people like me.
My question is actually for the sheriff.
Yes.
I wondered if you could give us a quick update on, how those kits are being used, not the kits, I'm sorry, the tests that we did with the opioid dollars a year ago. How
Oh, the
that,
pilot?
the pilot program, how that's going.
Yeah, so the pilot for the MAT program is what you're talking about, is up and running. We had a little bit of a slower start because obviously, as you know, we did the change in our medical provider. So we're working with therapeutics. They're working well with Vital Core, continuing to, part of that program is not just the medication that's given, but the therapy as well. Because as we've talked, and one reason that the jail lobby is key for the Narcan kits is we know that there's a 30% increase in overdose deaths when someone has been incarcerated, goes back out, that they start using back at a level they were after being incarcerated, there's an increased percentage in there. So they're continuing to work it. I think last time we had 16 people. We had the pilot about 15. We were a little slower getting started, but we're at full kind of capacity on that pilot. So we'll have more to continue to report.
Any other questions for Pete?
Question.
Yes, sir.
Are those kits distributed to the schools as well? I mean, obviously they should be in every school.
They should be, and that's part of my agenda. I haven't got into the schools yet. But I would hope that someday we're able to get in the schools and do these presentations and hand them out to the kids.
Are you envisioning something like with the school nurse or the health person, first aid person at the school?
I would love to partner with the local schools and do presentations, maybe in the auditoriums, or even like back to school night, setting up a booth out with all the other vendors that they have set up and handing out Narcan kits and explaining the process, and also as well breaking that stigma of having the Narcan. And just because you have it doesn't mean that you are necessarily associated with somebody who uses.
Yeah, there's a prevalence of school age overdoses. And so it certainly wouldn't be a logical step. Is there another question?
Mr. Chair,
Yes, sir.
if there's no other questions, we do have one more presentation to get through and also someone to introduce to the board.
Understood. Thank you, Pete.
Would you guys all like a Narcan kit?
Sure.
All right, we've got Guy Miller. Guy Miller is here today to talk to you about some plans and a funding scenario for improvements at the South County building. And this would be in the health department section of the South County building. I'll let him move in and then I'll help him.
Yeah,
Okay.
thanks, Brian. And thank you, Peter, for the hundreds of people you've trained with Narcan. Health department does Narcan training as well. Alongside Riverwood, it's great to have tons of resources here in Berrien County. He put up a list that's available online. If you Google Berrien County free Narcan, that list will come up of where you can find free Narcan in Berrien County. And I'm happy to say we have a lot of different areas across the county that we're doing that. Just some data I wanted to throw at you really quick. In 2022, Berrien County had 57 overdose deaths, which is the most we had seen in several years. In 2023, we had the same number, 57 again. Nearly 3 out of 4 of those deaths were opioid-related deaths, and they could have been reversed with life-saving Narcan. So you have the kid in front of you. Pete trained you today, so be thankful for that. And we're happy to get the education, the materials out. Health department is in the schools. We do presentations. We do a mock bedroom where we help parents identify areas where kids might be hiding substances. So check that out. That's something we offer for free to schools all across Berrien County. Before I get started in the presentation today, I do want to introduce a newer member to our team. He's actually been with us for a couple months, but the way that the hospital schedules the emergency room is several months out, and we're very thankful for that. But without further ado, Dr. Byer, if you'd like to introduce yourself to the board.
Hi, I'm John Byer. Oh, sorry.
There's a mic.
Pardon me. Hi, I'm Dr. Jonathan Byer. I wear several hats, but I'm the new medical director for the Berrien County Health Department. So thank you for hiring me. I'm also still an ER physician for Corewell Health. So I work in all 3 emergency departments. I'm also the EMS medical director for Berrien County. So multiple hats, multiple things. Thank you. And the sheriff's office, I work with their tactical team and their hazmat team. So occasionally I sleep. But not often. I want to thank Pete for that really excellent lecture. Just from the healthcare perspective, Narcan is a really important part of harm reduction. I'm really glad that everyone here was very receptive to it. Some places are skittish about it and they go, well, we're just enabling you. I'm glad that none of you have had that opinion. I'm glad all of you view it as a life-saving measure. So thank you for that.
Thank you,
Any
and
questions?
welcome to the new Dr. Rex, right?
Yes,
Dr. John.
Dr. John.
Thank you, Dr.
Okay.
Byer. All right, changing gears a little bit. This has been something that's been in the works for quite a while, and I'm happy to present the work that we've completed. Well, I guess this is the first step in the process. So we're talking about the Niles Health Department. We're talking about the needs we have, and if you haven't been down there in a while, this is a different view. This is kind of from the north facing. You can see the courthouse on the right there, the health department location on the left, and our entrance is right here between kind of those 2 large windowed areas. Actually, the windowed area to the left is our current space outlined in a green box, and the windowed area to the right is the current backup EOC location that we're looking to move into. Some things I'm going to go over today is signage, space, our flooring, our floor layout, furniture, conference rooms, offices, and reception areas. Looking at the signage of the building, believe it or not, we are here. This is the health department. We haven't had a sign. So there's no existing signage. You use door 12, you go in that vestibule and you turn to the left and you'll find the health department there. No out front signage identifying the health department at this location as well. Cramped is going to be a common word I use. Our spaces were designed in the late 60s, 70s, and it is tight, it is cramped. Exam rooms are not ideal workspaces for employees. You can see I've got in the lower left-hand corner here, I've got a picture of what we call an interview room. It's pretty tight. We really don't use that anymore. Every once in a while, since there's a phone in there, a nurse or our nurse practitioner will sit in there and they'll do charting in there. And to the right is our exam room. You can see the exam table on the left. We've got a sink in there. We've got our sharps containers. And this is another aspect on the right too of that space. This one has a little changing table and a stature board kind of on top of that folding table to the right. And this is one of our WIC areas. In the lower left-hand corner, this is us looking kind of from our office space through that interview room. And then in the far back is one of our exam rooms. The intention of this picture is that interview room in the middle, it takes up a lot of space and it is not utilized really how it should be, which would be we bring a patient in, they do an interview in the interview room, and then we bring them back to the clinic room. We just bring them back to the clinic room right away. That's, if you guys go to a doctor's appointment, that's what you see. Every once in a while, they'll take your height and your weight in the hallway. We're going to design some alcoves to do that in our new location. But this meeting room is not really necessary anymore. When we look at the office space, we do a lot of communicable disease investigations. We call people on the phone. We talk about sexually transmitted diseases. We talk about pregnancy. We talk about contraception use. We talk about immunizations. We have patient health records that we are talking about. We need a little bit more confined space. You can see I'm sitting at this desk here. I can see the desk next to me, and I can see the nurse to me, and I can hear her too. So it's not very ideal if I'm talking on the phone for patient privacy. Obviously, all of our staff are trained with HIPAA. So if we do hear something and we're not related to it, we don't relay that information. But I think as a patient talking about something confidential, you want to know that your conversation is private too. And that's difficult to do down in our South County building. This is it's a conference room, but this has been a multi-purpose room for us. You see, we've got a great map of Berrien County. That's actually used for our environmental health division. When we go out, we map an area, we're doing a soils evaluation. We have to identify by the parcel, so we've got the map up there. We've got a changing station in here because our WIC and our WIC breastfeeding uses this room. And this was, since Dr. Kowalska lived near the Niles area, this is where he worked twice a week. So it was a physician's office, a WIC clinic, and our EH room. So a great need for more space. A lot of things were happening in here, and conferences weren't, and that was our conference room. Our break room, very cramped. You can see staff's got bottled water stacked over there. We don't have potable water in this break room. We have a refrigerator, and for about 10 staff, I'd say 8 to 10 staff on any given day, we have 3 chairs in the break room. So there is obviously a need for a little bit more room for our staff to take a break. In our laboratory, which also doubles as our med room, it's very tight. If you look at the picture in the bottom left, you can't really fit 2 people in there comfortably. If you're working on something and a nurse needs to come in, you're spinning a laboratory sample down and a nurse comes in and she needs to draw up some medication or draw up a vaccine. This room is tight. It's maxed out already with 2 people in it. Our waiting room area, actually not cramped, quite a bit of space, but not a lot of privacy. So you can see at the windows, if you're checking in with one of our 3 registration desks, it is a little bit difficult to have a private conversation to tell them what you're there for that day. This is another angle of it. Looking at our front entryway, as I mentioned, you walk in the vestibule for the first door on the left. There is a sign above it that says health department, but there's not a lot of kind of a welcoming. It's a door. It does have a glass panel next to it, but I think having more of a welcoming environment would be desirable. So when we looked at the space, this is what we were looking at. The kind of darker purple area in the top right is all health department space. The top area is kind of our office area, and then you see the rooms kind of cut up. Those rooms right in the middle. Does this have a laser pointer? These rooms right in the middle right here are our interview rooms, and these rooms down here are exam rooms. This is our laboratory, and then these are our bathrooms right there, and then that's the waiting room. So we primarily enter that door 12 right here. We come in, and that's how you get to the health department. We are looking at, that is our existing space, the EOC space right here, currently being used by the county clerk for early voting, is all this kind of beige space over here. And then Veterans does use some of these offices 2 or 3 times a week to meet with veterans down at the South County building. So this is another picture of that available space. This is where the early elections are taking place down in Niles, currently set up for that. And they are using these offices rooms as well as secured storage. And then this left area is where veterans have been using 2. I don't even know how many rooms there are. There are several office rooms coming up and down here. They use 2 of those rooms. The rest of the rooms are really unused space. All right, so health department space, and this is currently the EOC space. And we've got, that's where the walls kind of end of the health department space, and that's where the walls kind of end if we combine this EOC space and all these private rooms. Our proposal today is to make this into the health department's clinical space, and I'll blow that up so we can see it and I'll go through it, and is to bring this space into a county conference room with 2 offices, a storage room, and a break room. So as I mentioned, health department needs more clinical rooms. We need medication storage. We need workflow privacy, and we need facility enhancements. This is the proposed space, which I really wanted you guys to take a look at today. Door number 12 right up here. We worked closely with Eckert Wardell over several months to come up with design. I think we went through 10 renditions of this. They are proposing a new canopy, vestibule, double vestibule doors here, and we've got an employee entrance right off those vestibule doors. Clients will walk down this hallway. They'll go to this. We've got new glass wall and door entry right here. So people will be able to see into the registration area. They'll say, yep, that's the health department. That's where I want to go. Patient flow roughly will come in this door, go down here. You'll go into one of the exam rooms. Then you'll come back out here, maybe go to laboratory sample, drop a laboratory sample. We've got a checkout station right here. And that'll be our waiting room. We'll have secured entries, access points here, 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 here. So we'll have 4 secured access points. Yes, sir. Just watch the clock. Okay. And then we'll have a secured access point here to get into the office area. We're moving from 4 examination rooms to 7 examination rooms. We have a lab draw area separate from our med room. We've got 10 workstations where we previously had 6. And we've got a small meeting room down here in the bottom left that can double, and a break room, but this is a partition between them, folding doors. We can put those up as needed if we need to have an intentional space for a break room, or we need to have an intentional space for a meeting room. We should be able to do both of those. We do have an existing IT room that will remain, that is currently there, that's not being touched. And we have our alcoves that I mentioned earlier that'll do our heights, weights, and a little bit of storage. The other space across the hall, this is the current space the health department is occupying. So again, north is this way. Our entrance is up here. I'm going to flip this image around. It's a little bit easier to see. So the entrance is down here. You walk in. This will be a new door into a 15-person staff lounge that's connected to a conference room. 2 office spaces. I worked closely with the clerk's office to make sure that their needs are being met for early voting in this space. But we're thinking beyond that too. In 10 years, what does this look like? In 15 years, what does this look like? 2 office spaces is desirable, especially because, well, Carrie was here. Carrie did mention that she had a need to have the courts come down to the South County building every once in a while, set up in an office space and meet with the public. Maureen with the veterans offices does meet with people down in the South County building. So having 2 kind of auxiliary office spaces is desirable. And then a room for table and chair storage as well. So the timeline, to kind of recap all this, we started with the RFP issuing in October of 2023, finalized our contract with Eckert Wardell in January 2024. We had about 10 different revisions, including additional spaces across each corridor. The construction budget was established by a contractor through Eckert Wardell Frederick Construction. And we are looking for a building phase to occur from January 2025 to August 2026. And that timeline is important for early voting right now. Working with the clerk's office, they have said that January 2025 is probably the earliest you'll be able to start. And we need that room by August 2026 to set up for voting. Getting into the costs, the health department did conduct this cost. We paid for the feasibility study. Our clinic side was $19,500. The conference break room was $3,300. In total, the feasibility study was $22,800. The cost for the building renovations for build, furniture, and the total are all kind of separated out. I did separate out the health clinic and office space from the break room. Originally, the break room consisted of the break room plus one of those office spaces. So I would imagine that build cost goes down a little bit, but you'll see it with the additional office space. So I think this will be a rough estimate. The total build for everything would be $1.7 million, roughly, is what the cost estimate was. Yes, sir.
We are 5 minutes past getting to committees. You're going to PHS. Can you continue the conversation with them? And then at 10:30.
PHS has already worked through this.
Okay.
So Guy's done a good job during his periodic.
This is my last slide.
Okay, very good. 1 minute.
Okay.
That was a good place to stop it before I wasted the money.
Yes,
So
yes.
So the Berrien County space renovations, what we're looking at, where the county would pay is about $667,000. The health department is taking on the costs through its own general fund. We have also got a CDC infrastructure grant of $704,000. Total cost for the health department renovation space, which will hit the health department under special funds, health department, general funds, $425,000 for us to do this space. I think that's very, very favorable. We'd like to chip in and we'd like to get this done within the time frame that was identified. That's all I have. Thank you very much.
Thank you, Guy.
Mr. Chair, just really quickly, so the work that still needs to be done is essentially, does the county desire a white box where the overflow space would be, or do we desire to have a little bit of a build out? My plan is to work with the admin committee on that question and then work with PHS on advancing the health side of the equation. I've done a really good job of building a capital stack to cover the costs of the build out on the health side. We just need to give him clearer direction on what occurs with what would now be the new overflow space. But from my perspective, if he can use state dollars to largely build this and improve the quality of services at the Niles location, that strikes me as just an absolute no-brainer.
Sure.
Really creative approach to getting the project funded. We just owe him some follow-up on what is left on what is currently the health side and will be the new overflow space.
Okay, very good. We'll hear from PHS in due course then. Well done, Guy. Let's get to committees.
Public comments?
Public comments, anybody have anything? Nope, okay, we're good.
Yeah.